Good afternoon. Good afternoon, everyone. Welcome to the Women's Leadership Council of Roosevelt University's annual holiday event. I'm Ann Ford, and I'm co-chair of the Women's Leadership Council. We thank you for your patience throughout our untimely technical difficulties this morning. We are trying desperately to get Dr. Ezike on a good connection. In the meantime, we're going to start the program with Clarita. I'm going to make just a couple of brief comments and then I will turn it over to Clarita. Although we're gathering virtually this year, we're very happy to be here together for this very special program. Clarita is going to fill in comments about the efforts of Blue Cross Blue Shield until we get Dr. Ezike on the line. The Women's Leadership Council connects our community with inspiring women who lead and make meaningful contributions to their industry, have a positive impact on their community. I don't think we could have more meaningful guests other than Dr. Ezike and our moderator, Clarita Santos. Now I'd like to introduce Clarita Santos, who is the Executive Director of Corporate and Civic Partnerships for Healthcare Service Corporation, the nation's largest customer-owned health insurer operating through its Blue Cross Blue Shield plans in Illinois, Montana, New Mexico, Oklahoma, and Texas. Working for the Office of the President and CEO, she's responsible for strategic planning and advancing key initiatives focused on access to care. Clarita, thank you for being here, and thank you for jumping in during our technical difficulties.
Oh, it's my pleasure, Anne. Thank you so much. I'm happy to be here. So one of the things I wanted to talk about is, as we're all going through COVID-19 and thinking about the work that's being done in the community, how do we approach it as HCSC? So as Anne shared, Healthcare Service Corporation is Blue Cross Blue Shield, New Mexico, Oklahoma, Montana, Illinois, and Texas. So one of the things that we talked about was really thinking about how do we think about COVID-19 from a local perspective. So we looked around within the organization and wanted to see how can we first engage with the community as one of the resources that we have on the ground. And so what we did was actually did a response grant called the COVID-19 response grant, where we collaborated with each of our plans in the different states to understand what the needs were within the community. Our first round was really focused on some of the needs that we were seeing. So one, as we know, as we think about Maslow's hierarchy of need, right? The primary level of need that we all saw and we all see is around food. So our first round of funding was really around meeting those basic needs. So how do we partner with organizations already doing that work in the community to provide these basic needs around food? From then on, what we understood is also partnering with our community-based organizations to understand what are some of the information needs. A lot of the work that we do at the state level entails partners with many non-for-profit organizations. So organizations that already do health literacy on the ground. One of the programs that we do is through our Caravan. So our Caravan program, what it does, it provides access to care by actually going into the communities. And so instead of, an individual going into an office to get an immunization, et cetera, we had our caravans. And so what our caravans did in the very beginning for COVID-19 is around information dissemination, right? And also around food delivery, because we know at that point, no one wanted to go outside. So what are some of the assets that we could leverage as an organization, fairly large organization, to be on the ground and respond to immediate needs? So from the beginning, one of the things that the Caravan program did was, in partnership with our Blue Door Neighborhood Centers, was actually help provide personal protectional equipment, right? So some of the masks, remember early on, if we go back to March, right, and it seems like such a long time ago, one of the things that everybody was grappling with was, let's go back a little bit in time. And during March, we were still trying to understand what COVID-19 was, right? We didn't understand what was its vector of transmission, how do we need to manage this? Should we mask, should we not? But as we learned, and I think that's the environment that we're seeing today in any type of infectious diseases, is we're continually in a learning environment. And so we learn and we adjust, and that's what we did as part of Healthcare Service Corporation, right, in collaboration with our plans in all the different states, is what did we learn? We learned that transmission was through aerosol transmission. And one of the biggest barriers in preventing transmission then was wearing a face mask. So then how do we quickly change that messaging from don't wear a mask to wear a mask? And I think the way you do that is by doing a community-based approach.
Thanks, Clarita. I want to pivot now to President Ali Malekzadeh for a couple of comments, and then we'll bring in Dr. Ezike. Thank you so much. Clarita, we're going to go right to Dr. Ezike.
Great. Thank you. Well, I have the pleasure of introducing our very special guest speaker. Dr. Ngozi Ezike is the director of the Illinois Department of Public Health. Dr. Ezike is a board-certified internist and pediatrician who previously worked for the Cook County Department of Public Health, where she served for more than 15 years. She was also the medical director at the Cook County Juvenile Temporary Detention Center. Prior to joining the Cook County Department of Public Health, Dr. Ezike served as Austin Health Center medical director, where she actively engaged in community on a variety of health initiatives. She has also delivered inpatient care at Stroger Hospital, primary and preventative care in community and school-based clinics. Dr. Ezike, it is truly an honor. Thank you for joining us today. Oh, I think you're on mute, Dr. Ezike. You may want to unmute. Awesome.
I'm smarter when I'm muted.
Me too. It's great to see it. And first, I wanted to see at some point if I can get your autograph, from Chicago Magazine. You and Dr. Arwady are one of the 2020 Chicagoans of the Year as Dream Team. So I wanted to say congratulations. When I get your autograph, I need that so I can show my mom. So congratulations.
Thank you so much.
Well, we're here today to talk about leadership, and I love these types of forums where we can kind of step back and think about, what it is to be a leader. And what I wanted to comment on you is that, I think like a lot of people, we feel that we know you because we see you every day, Dr. Ezike, telling us what we need to do to stay safe. And time again, you show this genuine compassion while presenting information that's really difficult to broadcast, to the public. How do you do that? You do that time and time again, where you bring your whole self as a leader. Talk to us. How do you stay connected in being that type of leader?
Well, thank you. So, I always say there's no other way than to bring my whole self. It's the easiest person for me to bring because I know her the best. Right. I don't have to fake anything, but really, right. We bring. It's a tremendous honor to be in this position at this time, despite the difficulty, and it's an overwhelming responsibility to have so many people looking towards me and IDPH in terms of guidance through this difficult time. But I consider it a privilege and an honor. It is. There's nothing more that we're supposed to do besides serving others. It can't be about self, and so I bring my whole self, my entire being. I'm not just a public health leader. I can't divorce the fact that I'm a physician who's taken that oath to do no harm. I can't separate the fact that I'm a mother and I have that natural instinct to be caring and nurturing. And I'm a woman of faith that's led by needing to love and to serve. And so all of that is what we get every day. Take it or leave it.
Right. We will take it and still take more of it. And you are, you're in the public eye daily, right? So you're leading Illinois through this pandemic. You are top doc. I love how you are top doc. What are some strategies that you use in your personal life that you do apply to your professional life?
Yeah, it's a great question. I think, like we said, I bring my true, authentic self. The things that are really important to me in terms of how I keep myself grounded is to make sure that I kind of start the day the same. And so for me, that means starting off with prayer and meditation. I need to kind of level set to start. And when I don't, you can absolutely tell the difference in the day. I try to have some things that are staples for me, working out and exercise. Not so much that I love working out and exercise. I actually love competitive play. But since tennis, I've stopped myself from playing tennis right now. So I've had to, I do work out now. And so even though it's not the way that I like to do it, I feel accomplished that I've done something that's helping me to stay healthy, which is obviously one of the key things that we're working towards, is making everybody healthy. So I'm working to keep myself physically healthy. It helps with my mental health. And it, shows me that, I have priorities that I need to take care of in order to give what I need to give to the rest of the people. And then finally, I have to make sure that I connect with the people who just give me strength. And I have an incredible network of support in terms of amazing friends, an amazing husband, and amazing children.
That's wonderful. Yeah, talk to a little bit about it. We hear a lot of very successful leaders like yourself talking about having this network of individuals, right? Do you have different networks to meet different needs, or how do you? Talk to us a little bit about these networks and how what's worked for you. You're very successful as a leader. Share with us, because there's a broad range of leaders. There's about 426 people on the virtual meeting. So in different parts of leadership, share with us a little bit about that.
Yeah, no, I mean, I've been so blessed to come in contact over time with so many exceptional people, exceptional leaders, experts. And because I'm such a relational type of person, I don't do surface connections.
Yes.
I'm that kind of person. Like, one of my best friends, and she is the one who's been helping me with public speaking and trying to be able to get over the nerves and be able to do this every day. I met her in Walmart like a decade ago, because it was the middle of the night, like midnight, the day before school was starting, and we were both in the lunchbox section. And so I knew that
I understand that. Mom. Yes.
She was another mom trying to pull it together for the first day of school. And we bonded around that, and we turned out that, we had kids that were similar ages. And since then, we have been such good friends. And turns out that she is a public speaking coach. So imagine that. So I have so many of these not so chance connections from throughout my life, and so grateful that all of these people have become family of sorts. And so it's so easy to be able to reach out, or they'll come to me and say, hey, I can help you with this, I can help you with that. And that has been the story of my life. I consider it blessings, all of these people, and they form what we call like my kitchen, advisory group. And it has so many people, and it's really been more than enough to help me get through all the challenges and the difficulties. I don't have to have all the answers, but I am surrounded both at work and in my personal life with people who can help me get to the answers.
That's right. Now, I'm going to pivot just a little bit because you are our top dog with the Illinois Department of Public Health, and you're managing through this pandemic. And so one of the questions that we are getting is the role of government in playing in the pandemic. What type of infrastructure do you feel is needed as we address the pandemic?
Well, obviously, government, when you think about the public health agency, our goal, what we need is to be able to help people achieve their optimal health, their best health. And so we want to do that, especially for the people where there are already some established impediments to doing that, and making it have a clearer path for the people that have so many roadblocks. Part of that involves having trust in the government. And so trusted government is almost an oxymoron of sorts. And so being able to get through that, and again, in this situation, this unprecedented situation, there are so many ideas on how to get to where we all want to get, which is the end of this pandemic. There are no shortage of ideas. And, even good people with good intentions, we can disagree, we can absolutely disagree on the path to go. And I'm fine with that, but what I want to do is to help people get the information they need, remove the stuff. There's stuff that is just not helpful. There's stuff that's counter to anything productive, that's patently false. Like, help people see that, remove, that pile of turd from the way, and then help people just really have, the information they need, the skills they need to make the best informed choices for themselves and for their family. And so we really I see our role in government as being able to foster that, give people the tools they need. And there are different ways that, we can think about those tools, whether it's, overcoming language barriers, which we try to do, which, educating people in the way that they can receive it. All of that together, I think, is one of the main goals of government, especially in this pandemic, to help people get to the point where they have the ability to make the best decision and choice for them and their families.
That's right. And I remember when we were working together on the Illinois COVID Response Fund. One of the first meetings you led with the data, and you talked about what was the incidence of COVID-19, what was happening throughout Illinois, and I remember how that's very helpful in guiding science-based information. So to your point, it's the role of government in providing helpful information. So thank you for that, Dr. Ezike. So I'm going to switch a little bit and just talking about, one of the things about leadership is people talk about leadership as also being a privilege as well as being a gift. What about leadership do you find is a gift? Have you encountered, have you find that you've had to change your management style or leadership style based on your team? How has that changed over the years?
Yeah, so in terms of my management style and how I've had to adjust with my team, I think the main thing is that I have had to grow and develop my own management style.
Yes.
I have an incredible team. I have 1,200 public health experts in different, facets of public health who have been doing this work for so long. And I had to get out of the way and get off of this do-it-yourself concept and realize that I just have to lean in to the experts that are already here, committed, dedicated, talented, and allow them to birth the incredible ideas, to be able to give the incredible solutions so that we could move forward. And so being able to effectively delegate is a very key part of that. And then understanding when things aren't working out the way I wanted or expected, like what in my management style needed adjustment. And often it's that my expectations or request wasn't clear. So the communication, being very clear, following up with, first speaking it, then also following up with written communication so that it could also be clear, having timelines. Maybe people understood, but didn't understand how pressing it was.
Right.
Being able to put the timeline so that people can have a clear path in terms of how quickly we need to get to that final point. So I think I have just really grown so much. I think there's still more growing for me to do, but I have grown so much in understanding how to be a more effective manager. But the amazing team was already in place. I have been able to add some additional great team members recently. And so we just have that great team, and then you create an environment where people know that they're trusted so that they are empowered to speak and give birth to these great ideas.
That's great. And I think one of the skill, and you hit the nail on the head, especially with the over 1,000, experts and professionals you work with, is the art of delegation. What has worked for you in terms of delegating? Is there something in particular, like if you have, there's some first-time managers on this during this meeting. Is there any tips you would give to first-time managers on how to delegate effectively?
Yeah, no, that I think, when they ask about real estate, they say, what are the most important things? What are the top three things? They say location, location.
Location. Yeah.
And I was recently doing some like premarital counseling, and I told the couple, like, what are the three key things? Communication, communication,
Yeah.
communication. And I think that's the same for delegation, right? It's communication, communication, communication. Because again, like I tried to explain, it's often that, if you delegate, you know what you want. It's a matter of, did the recipient understand what you want? Did they are you sure they had the tools to give you what you want? And so it's through communication that you can ask the right questions to make sure that those things are in place. There's a joke my husband always says in terms of, having a plate of food at a restaurant, and the food is absolutely scrumptious, and the waiter comes by and is like, what did you think of it? And it looks so good, but you haven't taken a bite of it. And the waiter's like, well, what do you think? And you're just looking at them. It's like, well, I had no cutlery, right? So you didn't have all the tools necessary to really get what you wanted done, which is to get at this wonderful meal. So again, identifying, through communication, where you want to go, the timeline on which you want to get there, and what is needed, and then identifying the obstacles that might need to be removed in order to get all those things done. Like that's all achieved through effective communication. And again, bi-directional communication, so you can hear what those obstacles are. What did the person hear what you thought you were putting down?
That is a great point. Like I think a lot of times around delegation, I think people think it's a one way, but it's really the feedback between individuals. So that's absolutely right. And I'm seeing a pattern, Dr. Ezike, from your friend that you met in Walmart and to the team that you lead as part of IDPH. That looks like what you do is you find the strengths in people and assets, believe in those strengths and assets and skills in order for them to become their best selves. Is that something that you apply? It sounds like that's what you do.
I absolutely do. I love people. The Walmart, when you used to fly places, right? I would be the one. My family's all in California, and if you were sitting next to me, we would know everything about each other. So if you wanted to just sleep, you do not need to be sitting next to me. So I love people. I care for people. You want the best for people. And so in that, that even if there are challenges, there are usually ways to surmount and get over those challenges. And so being able to work through difficulties so that people can thrive. Yeah, I am absolutely a champion for that.
And Dr. Ezike, so you're a California. So what brought you to the Midwest from California? I understand you're from Los Angeles. Is that right?
Yeah,
that's right. Yeah. I'm from Long Beach, so California. Yes, we got to catch up.
Yeah. So what are we doing here? Okay.
We're being called.
I just came out for work, and it was like, okay, I'm just going to do this stint. It was supposed to be a couple of years, do the internship and residency, and then head right back to Cali. And again, as a relational person, in literally month one, I met the love of my life. We were engaged we were engaged like 3 or 4 months later. So,
So you got to tell us how you met. This is, how did you all meet? Did you all meet in medical school or?
I was training at Rush Hospital. He was a trainee at Cook County Hospital, and somebody who knew both of us said, I have somebody I'd like you to meet. And it was like,
I love that.
Okay. And it works out, it worked out.
Yeah, it totally does.
Yep.
Oh, that's wonderful. Wonderful. That's wonderful. I think the other thing I wanted to share with you is, as part of leadership, we have different sides to ourselves, right? And you talked about, ways that you keep yourself, you talked about you do exercise is there other things that you do that helps you stay positive and manage kind of the stress that you encounter as a leader?
Yeah, so I mean, the keys are, exercise, prayer and meditation, and then connecting with the people that just give me strength and life. I don't keep a lot of energy for people who have negative energy. That's as infectious as COVID.
I like that.
I steer clear of that.
They sneeze on you. I'm just kidding.
So I stay around people that, uplift me and that we uplift each other and that we are staying positive and looking at the glass as half full, because there's just so many more possibilities going that route than the alternative.
Yeah, that you're right. Talk to me about what you're excited about. So you're right about that, glass half full, glass half empty. What are some of the things that you see that are half full, coming into the future? Can you share with us a couple of those things?
I am motivated and excited for the future. The intense collaboration
Yes.
statewide that has taken place, that we've all gathered around to get together to make things better. If we can hold on to this even after COVID is in the rearview mirror, we can tackle racial injustice. We can tackle the AIDS epidemic. We can tackle maternal mortality and so many issues in public health and beyond. So I am encouraged that we can get together and we can put aside, just personal things for the greater good for the most part. We've seen that some people can't do that, right? But for the most part, we see that many can. And so we have to leverage this important thing so that we can move the ball forward in so many different aspects.
Wonderful. Dr. Ezike, we've got some audience questions that I'm gonna share with you that are coming up. The one that we got is, thank you so much, Dr. Ezike, for your leadership. How do you stay optimistic as you work through today's challenges?
No, that's a great question. And I am reminded, especially just coming off the heels of Thanksgiving, it was like, I think everybody, well, if we were following the guidelines,
it was a small
Thanksgiving looks a little bit different.
Just a little. That's all right.
I am usually, either in California or with my husband's family, and we do it big.
Right.
We didn't get to do that, and yet it was one of the most special Thanksgivings because we had this massive Zoom call, and it turned out not to just be with mom and the siblings. We brought in multiple cousin households because we could all get on the Zoom, and it turned out to be the biggest Thanksgiving we've ever had. Virtually seeing all these people that we wouldn't have been with together on Thanksgiving, and so it really gave us an opportunity to realize that there's beauty even in the ashes. There's how many people said that they've had more family dinners than they've ever had during this COVID time? How many people said that they've gotten to know their kids so much better, so much more quality time?
That's right.
So many things that have come up as really good things. The ability, our world is cleaner because of less smog emissions from people who are able to work from home, right?
That's right.
Things that we are thankful. And so starting with that foundation, you have to stay optimistic because no matter how bad or dire the situation is, it could be worse. And so we have to be thankful for what we have and keep working to make our reality even brighter and better.
Right, absolutely. So we have another audience question, Dr. Ezike. I would like to ask Dr. Ezike, how do you build confidence with a large team as a trusted leader?
And I think you've seen that it's by being open, transparent, and vulnerable. There is power in vulnerability. I know when I talk to my team, I will come out there first and say, I'm stressed. I'm completely overwhelmed. I'm seeking help. And you probably are in the same boat too. And I'm urging you to seek help too. I tell people very intentionally, look, people, we have to take vacation. we have to prioritize ourselves and restore and give ourselves back what we need so that we have something left to give others. The work has been just endless, but you have to balance. And I know I got a lot of pushback from hospitals saying, when you close, your lab down, that causes another delay in getting test results. But I had to make sure that I give my people in the lab Thanksgiving off. They have to have a day off. They have to have a day to recharge and to take a breath and to exhale. And so, yes, I know that there are consequences to that decision, but if I'm true that we all need to take care of ourselves, you have to make some of those difficult decisions.
Yeah, absolutely. I mean, that's what makes us human beings, right? We want to be human. And so part of that being human is giving people breaks. And that's the part of leadership, is balancing those and making sure that you take care of people. Here's one. Is there anything that keeps you awake at night?
So it implied in that question is that I'm sleeping at night.
Okay, let's talk about that first. Fair enough.
No, I mean, I'm actually coming off of a rough stretch these last 2 days. And, every once in a while that happens where you just have to go continuously. But again, if I'm trying to follow what I'm preaching, you do have to make time for yourself. And, my daughter knew because she found me, on the couch. And she said that she had woken up in the middle of the night to do dishes. So she knew, like, she had a sense of how little sleep I got last night. And so she came to me in the morning and was like, Mommy, I know you didn't sleep much last night. So I think you have to go. I'm going to make sure you go to bed early today, And so I just appreciate being surrounded by loving little people and not so little people. Actually, my kids are like bigger than me, but
but there'll always be babies in our minds, right?
They're babies in my mind, but like they're like 6 feet tall. And you're just like, thanks, sweetie. But I have nurturing people who are trying to remind me to follow through on the self-care that I say is so important. But sometimes in the midst of this pandemic, it is hard to actualize it. I've been, really trying to force, taking my vitamins and doing the workouts and trying to get that sleep. And so sometimes you can't get it every time, but you remember that you have to come back to it because it will catch up. It will catch up with you.
That's right. Dr. Ezike, what work would you like to see women's organizations like Delta Sigma Theta sorority, example, do locally to support public health needs in Illinois?
Yeah, no, there's so much work to be done. If I laser focused on, mass vaccination right now, we know this is going to be such a Herculean feat that we are embarking on. Not only are we going to be dealing with, brand new vaccines of a new platform that we don't really have every single answer to the questions that may be asked, and so being able to transparently share what we do know as well as what we don't know, being able to figure out how to get it to as many people as possible, as equitably as possible, as quickly as possible. And also, how do you get people to want to take this? And so there are all these organizations, especially my sorors of Delta Sigma Theta Sorority Incorporated, will have a huge role in doing that ground game work, talking to people, virtual town halls, giving the information that we talked about in the beginning, the information that people need in order to make the best decision for themselves, and making sure that obstacles to at least knowing true facts, again, removing the turd, but true facts, being able to have that accessible to people throughout. That's a big help that organizations can do towards, educating the masses and encouraging people to get the appropriate tools and education.
Right. And are you seeing that different communities, I know you've got I know it's a WWW, right? Wear a mask, wash your hands, and then watch your distance. Are you seeing people like turning this and making their own? Because I think that's such an effective education campaign. What are you seeing changes in that, or what? I'm wondering what you see across the state. Are people making their own, or do you see little tweaks here?
Yeah, no, I think people are using it's easy to remember. You know, I
Mhm.
translated it for Spanish, and it's los tres M's en español. Usa su máscara, which is mask.
Mask.
Mantenga su distancia, like watch your distance, maintain your distance, and
Mhm.
manos, wash the hands. So, however,
Ah.
whatever letter, whatever you want to use, just do it. Just do it.
Just do it. Right. Right. So one of the other questions is around just in general. I know there's been a lot of talk about the COVID-19 vaccine and safety. What would you say to our Black community members concerning COVID-19 vaccine and its safety?
You said, what would I say to whom?
What would you say to our Black community members concerned about COVID-19 vaccine and safety?
Yeah, no, I understand. I do. Like, I understand the hesitancy. You know, the Black community has had a strained relationship with public health.
Right.
So there is reason to be concerned and want to, you know, tread slowly, lightly, and make sure that this is the right thing. And so I think, first of all, owning, you know, the history that is the history between public health and the African American community in the United States is very important. And then being, you know, apologizing for that, and then trying to ask the community what they need to help rebuild that trust.
That's right.
There is
That's right.
a long, you know, history of
It's
vaccine.
key.
There's a history of, you know, injustice, but there's also a history of vaccine science that says that vaccines are helpful. They're one of the top, you know, inventions of modern medicine for the 20th century.
That's right.
Why we don't have people with polio or smallpox, and when people actually take their vaccines, measles, right? And so we do know a lot about vaccines. I know that the information is more limited about this COVID vaccine, and we have to own that. And so I think just openness, transparency, honesty is the only way to go, because, you know, I don't have a crystal ball to tell you what would happen a year from now with this vaccine. I don't know if it will confer protection, you know, for 9 months from now. Nobody can say that definitively. And so I want to be able to share that, so you know what I know, and then can make the appropriate decisions from now. I can't afford to just say whatever just to try to convince you for today, and then something else happen. That ruins public health standing for more generations to come, and will make people stop taking maybe all vaccines. So there's a lot on the line here. And so again, honesty, transparency, straightforwardness, that's the only way to go forward.
That's right. And I think one of the things too, and I think this is one of the key components of leadership, is this. I mean, what COVID-19 has shown us is this continual learning environment, right? In that, I mean, think about what we've learned from March to now, you know, even the possibility of a vaccine is, you know, it's wonderful. Do you find that as leader that you're constantly learning, that you're constantly, you know, whether it's information to, you know, these things, do you feel yourself always in that type of mode of continually learning?
Absolutely. I mean, especially with something that I didn't learn this in medical school.
Yeah.
I didn't know anything about this in even 2019, right? And so it's like almost information overload, trying to keep up on top of everything, so that, you know, when someone, you know, throws a microphone in front of you and asks you a question, that you can help, you know, first of all, engender trust that you know what you're doing, and that you're trying to stay on top of the situation, and that you understand that things are evolving, and can be able to message how things change, not because people don't know what they're doing, but that there's more information coming in, more inputs that can help us refine, you know, what is known.
Right. Now you have a big job as the head of the Illinois Department of Public Health, and as you think about your career trajectory, are there certain milestones that really prepared you for where you are now, or is there something that you can think about was like at that time you're like, I'm not understanding why I'm in this situation now, but now you're saying, oh, I'm so glad I'm in that situation because it prepares me for what I'm doing now. Are there any instances of that you can recall from your past experience to lead you up to where you are now?
So I always say that there is no experience that is wasted.
Mm-hmm.
Anything that you've been through, forms part of the fabric of who you are and can be used, for future tests and trials. I remember in college when I, was taking, physics and chemistry and biochem, and then I would throw in a Spanish class, and my dad would be like, my dad was like a hardcore scientist, and he was like, Spanish? What's that for? And I was like,
What's that for?
I like languages, Dad. And
That's right.
Like, huh? And then another semester I was taking French and then Swahili. But being able to speak Spanish has been one of the most wonderful things that I've brought. And so I see that that's important. Having been in trying to choose my field of specialty, I did both internal medicine and pediatrics. So basically you can take care of from popping out to the end. And, being able to, know a lot about adult medicine and pediatric medicine makes me, so much more facile when we're talking about the issue of COVID in relation to pediatrics versus in older populations and everything in between. Understanding, the different conditions related to, breastfeeding and COVID, because I've done so much work on that. So there's nothing that I've done that's been wasted. It's all been additive and helpful. And I hope that I bring that to everything that I do, taking stock of all the things that I've learned and bringing that to today's challenges. And even working in, I worked in the detention center. Very few people have a full understanding of what it's like to work in a correctional setting. And I know, how infections spread so quickly. I know how, correctional officers work and how that plays in to, the residents or the inmates. And so being able to see how that experience has helped as I was looking at the, very serious outbreaks that, can happen in these congregate facilities, including correctional. Like, I'm just grateful for everything that I've had the opportunity to do in the past. It's all been just added bonus.
That's great. Well, I'd like to thank the audience members for their wonderful question, and Dr. Ezike for all of your insights. Are there any final closing remarks that you would like to make?
I guess, I'm excited to be able to be here addressing women's leadership team, and just want to make sure that as women leaders, it's great to celebrate women leaders. We have to. But beyond that, we have to make sure that as women leaders, that we are grooming the next generation of women leaders, that we are keeping the door open that we came through so that others can come behind, that we are sweeping up the shards of glass from the ceilings that we've broken.
That's right.
So that people don't cut their feet on as they follow us through, that we're creating a seat at the table so that other women can come and sit, and not just sit there, but that we will push them to use that voice, that unique voice that will represent a truth that is only their own, that needs to be heard, that we will empower women and not fight with each other, but build each other up so that we can continue to assume our very important roles in society, in the world.
Dr. Ezike, I love that. We need to sweep up the shards of glass so that nobody else will get cut on as we break the scene. I love it. Well, again, Dr. Ezike, thank you so much for your insightful comments and perspectives around leadership. We are very, very thankful to have you as our top doc. So thank you so much.
Thank you so much for having me. Thank you.
Thank you. You're welcome. So now I'm going to turn it over to the Women's Leadership Council co-chair, Clarita Santos, who will be giving closing remarks.
Hello there. I think hopefully, can everyone hear me? Clarita, doctors.
Yes, we can hear you.
You can hear me, just not see me for some reason?
Yes.
Okay. Well, we'll just stick with that technical difficulty and I will just speak. Thank you both. You have been I mean, absolutely amazing examples of leaders. Clarita, I don't think we could have had a better moderator. And Dr. Ezike, I mean, every day in March and April, I planned my life around when you were going to be on TV. You reminded us every day that leadership is not easy. It takes courage, transparency, empathy. I'm not going to lie. I was always extremely impressed by how well dressed you were and how awesome you looked while doing such an amazingly difficult task in both English and Spanish. And I will say we've had numerous comments throughout requesting Dr. Ezike for president, which I would be fully supportive of. And the number of times the word inspiration has been in this feed is amazing. So thank you. Needless to say, we also thought when we asked you to join us that, you know, this would have subsided and we certainly wouldn't be in the worst part of the pandemic yet. So the fact that you are still here, still made time for us, we just really appreciate, and I do hope you get some rest. To all of our guests who have been here, again, hopefully you did find this to be incredibly inspirational. And thank you for all your comments and questions. We would definitely encourage you all, if you haven't done so already, to consider making a contribution to the Student Emergency Fund. This is a fund that provides emergency grants to Roosevelt University students with temporary financial difficulties due to the pandemic. There's a link flashing across the screen, and you can also find that at roosevelt.edu/WLC give. Any contribution is welcome. We know not everyone is in a position to do so, but even $5 or $10 makes a huge difference for those who need it. And so thank you to everyone for joining us. A huge thanks to the Roosevelt team who orchestrated all of this. Thank you for bearing with us, everyone, through our technical difficulties, and have a wonderful holiday. Stay safe, wear those masks, wash your hands, and hopefully we'll be out of this soon.